Sudden under eye bags. From my ill health or bad luck? Are fillers viable for minor bags? I am 33 years old and healthy. I have no family history of bags. 5 viruses this year left me with colitis, and now petrositis. I was anemic and now have low iron. My eye bags came on quickly in May while on birth control. I stopped because I still had bags. I was on prednisone 2 weeks in June and bags went away, but it came back after stopping meds. Does this mean they are not fat but rather fluid or inflammation? Could petrositis indirectly cause this? Anemia? Are fillers a viable option until surgery can be afforded?
Thank you for your question. Your question about sudden under eye bags, and you revealed a medical history which certainly can be a factor in the appearance of your facial appearance, as well as have possibly some contributing factor to the progression of the under eye bags. So let me just give you an idea of what we would do in our practice. I'm a cosmetic oculofacial plastic surgeon specializing in this area for over 20 years. And I can tell you that many people come to us with different variations of a story like yours. Now, you had recurrent viral infections and you've had this petrositis, and certainly stress. When it comes down to it becomes almost like a common factor of a significant physical stress that can potentially contribute to the under eye bags. Now, the best way to figure out whether or not these puffy under eye bags are going to be there long term versus having variability is to understand first the anatomy. So what are the bags under the eyes? The bags under the eyes represent lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eyes pushes forward. Now, most of the time, even with a clinical history of sinus issues, allergies, sinus surgery, other related things, factors that can cause facial swelling, there is often still a hereditary factor. Now, if it doesn't run in your family, that may be something to just factor in when you're thinking about your management. But when people first notice under eye bags, in the absence of a history like yours, they always mention that they have some good days and then some not so good days. And then as time goes on, they tend to have not so good days most of the time. And that means the puffiness is always present. Now, given your current medical situation that's still evolving, especially with the anemia being a factor, I think that it is not unreasonable to consider a non-surgical option such as the use of a filler like a hyaluronic acid. In our practice for under eye fat pockets that are very early and minimal, we do perform the application of hyaluronic acid, such as Restylane, placed into the tear trough area to try to soften the transition between the puffy bag and the valley underneath, which makes the puffy bag look more puffy. A lot of times doctors will be a little overzealous and try to fill in an area when someone has too much fat, prolapsing fat, and then it just looks terrible. Now, you should also be mindful that hyaluronic acid fillers can also cause swelling. So the approach should be relatively conservative if you're going to try that first. In our practice, we also commonly combine hyaluronic acid fillers with platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it is the concentration of the healing and growth factors necessary for wound healing that helps improve the skin quality and acts very well in synergy with hyaluronic acid. Again, with the issues of your medical history still in flux, I think conservative options are probably best explored rather than moving forward directly with surgery. But at the same time, it is probably to your benefit to not do any kind of intervention and observe whether or not the fat pockets are consistently there for weeks at a time, so that you can at least have a sense of the constant nature of the fat pockets being present. So again, to summarize, I'm suggesting that you consider a non-surgical option, such as the use of hyaluronic acid filler to fill in the tear trough, after establishing that regardless of your physical health, whether it's the viral issues, the recurrent infections, the petrositis, all those things being relatively stable, and the puffiness remains, then moving forward with a non-surgical intervention is probably worth exploring. So I hope that was helpful. I wish you the best of luck, and thank you for your question.